Minister of Information and Civic Education, because it is his responsibility to always come and the other side, to say, oh, actually this is what's about. And even to some extent, they've had to put government papers that are normally rectified to the public, because of the way things are today. So he has an enormous responsibility. I suspect that has reflected in his budget. Communication budget. Ladies and gentlemen, I have the singular honor. It's not every day we get an honor like this to introduce Minister of Information and Civic Education, the Honorable Chairman Bar.
Thank you. The Honorable Minister for Health. By the way, one public information is that the ministry is no longer Health and Sanitation. It's just Ministry of Health. You will get into trouble with my colleague who is now the Minister for Water and Sanitation if you keep referring to this ministry as Health and Sanitation. Honorable Minister of Health, thank you very much. Mr. Chair, Chair of IMC, President of Women Media, friends of the 4th Estates, members of the Ministry of Health, Fraternity, Assalamu alaikum, I greet you all well. It's great to be here. I think big things are happening in this country. The health sector is witnessing a seismic transformation. Not also begins forgets the Ministry of Health. I think everybody knew that I was going to switch to the you have the Ministry of Health, you have a minister that understands that for every change here, there is one about the work that's been done, but there's also the need to bridge the gap between the quality of work that's been done and the people getting that information. This is a minister and a ministry, by the way, that have demonstrated that they understand the instinct of public information. You cannot win this life studies approach that I'm sure is going to talk about. We cannot win the health challenge battle in this country if we are not communicating with the public. Health is the public. Before we came in here, we were discussing and we both said that the only sector you cannot truly say, I don't forget, active or do it, health. At some point in our lives, we are all implicated in the health system. And when we had the minister at the press conference I think a couple of weeks ago, I said something that when we decide for Move Come Back Salon, I did a long video with my family, our kids, we move back to this country. The one risk we take to move to Salon, it's not quality of life. The quality of my life is better here than it was in the US, I can tell you that. I live well, but I can live a bigger life here. You can take care of all your amenities. Everything else is guaranteed here. The one big challenge typically is health. If something happens to you, pray there. Immediately, the first instinct is if you get small money, bam, for corona. Because we, for a long time, we get belief in the health sector. That's what this minister, that's what this ministry is changing. We see the world's more than Peking Hospital William Hill. We see the plans that they have across the country. We see all of this transformation that's happening. But I'm here to say and to reiterate what I know the minister believes, that even if they change all of that, remember, it's both belief, it's perception, it's also reality. If they change the substance of the health sector and all the transformation that's happening, it will not change the perception, it will not change the public information on the health sector. We still have not done the full job. That's where you come in, my brothers and sisters, the friends in the 4th Estate. And I know there's a big discussion now about the difference between all the bloggers versus the non-bloggers. I know there's this tension where if the traditional media they look down on the bloggers, fact of the matter is that this is not going to change. Your sector has changed. Our sector don't change. All man now are journalists. Everybody now can report. Yesterday they set us, as Doc was saying, into a tailspin, literally. Maybe they were bearing a go. My colleague starts calling me and say, Air Force, plane don't land in Anuki. They say no need to fake news all over social media. I started looking into different groups. Wildfire! Then they force us to go out of the way to say, because there's a lack of public trust, to provide the real information. Even after that, some people still continue with fake news. But the public trust deficit, not just because of people not believe in big governments, but also in the intermediary between we and the people. Because if one good journalist pick up the phone when you see that news and reach out to the ministry or to civil aviation and get the information and release it to the public, that one good journalist is supposed to be so powerful that he will bring down the fake news. This is the challenge that we have. Somebody has mentioned the challenge of culture journalism. Yeah, I'm so used to it now. You see all the amazing things Ministry of Health is doing. Sometimes we see so much bad fake news online about the ministry. And people are focused on the small negative. I had a big argument a couple of weeks ago with your fact checking group. I went on air. I said, last time we President Bill Power, energy access was about 13%. I used the English word about 13%. The fact checker, the official fact checker, this is the logo check. The real number are 15, and then slam seriously the minister says yes, they did it. It's that bad. I used the English word about 13. They don't even say potentially misleading, they don't even say the minister can be worse. Because there's this desire for over-sensationalize and force like bigger, they run faster than if you say, oh, the minister can be more exact. No, you need to say for because you're thinking that you compete with the blogger. Because the blogger you may go faster, so you say you need to go faster. Go for resist that urge. And I think what today is about is to say, let us bridge the gap. We all have a similar interest here. We want this country go before. The minister, day and night, in colleagues in the ministry, we want this country go before. We want to change the narrative of the country. We want to change the reality of this country. That change here requires a strong, dedicated partnership between we and UNA, as governments, as the 4 states. And I think what we don't try to do so far, now for sure, I say we are available. Like me, I'm available. Anytime you pick up the phone and call me, I'll answer. If you know you get me, I have other colleagues in the office where you get them, they reach out to me, they provide the information. So before you hit send, before you go and put bad news, before you go and put something you call scare, just ask. We only ask for it to be biased. We ask for it to be fair. We also ask for it you hold, just like I hold it to a high standard. You said before they check, you put false or fake or lie news per week at any of it. We always check and hold yourself to a high standard. So I want to take this opportunity again for telling you thank you as the 4 states. Because in the midst of all these other complaints that we have and the challenges that we face, a lot of things are going well. We don't change the whole thing. You also have changed a lot of things, and things are getting better. We have an excellent relationship with Slash, the Guild of Editors. We're building on that. And in this partnership with the Ministry of Health, which, as I said, is probably the most important ministry for we all will survive as a state, as individuals, as people in this country. We begin a life, normal life, women life, adolescents, at every single stage. So this I call for, say, let's build on that partnership. then we focus on how we tell the positive stories and the challenging stories. Then we'll go deep down and then we focus on the facts. I look forward to this partnership. I look forward to the Minister on Health in statements. But more than that, I look forward to the interaction where I hope to say will be the highlights of today's engagement. Assalamu alaikum.
Thank you for your good message. Well taken. Ladies and gentlemen, I'm not going to attempt to introduce the Minister of Health.
One Sabi talk minister. Sabi tell the story. I just want to stand on existing protocols. I don't know it's a high table. I acknowledge everybody there. I think it's the preferred language. Cool. We talk and make sure say I know they only talk to we all have, but also they talk to the nation. We all understand. So we'll get a form of English decided. But just a few things. I want to reintroduce myself to Smallies and why are they so. And I want to share with my the ministry in vision and why I make this vision here really important. I want to also talk to the role of the media for let me realize history. And just a few things I want to acknowledge at the outset. Number one, and the fact that we not say we not to mirror to ourselves. We not see ourselves. Now, una de see we. Now, una de see we directly, and now una de see we on behalf of the people of Sierra Leone, all 8 million of them. So we respect that. We respect the partnership where they come with that, the constructive relationship where they come with that, and the notion say, if we succeed, I want to succeed. If we succeed and want to succeed, Salon succeed. So we did in this collectively, we did in this together. One of the first important things we must do when you get this kind of job, now for check you pride Lungi Airport. You have to be honest. You have to get a listening ear. And you know they only listen, but you also the yay waiting and listen. And we want to tell them, say, the ministry, if not obvious to her, a very listening ministry. And if you not gets to us our goal, we'll try to do a better job to not only listen but understand. Me, I'm in the America, and they also, the head of facilities in Ashebima in the 80s. I worked on hemorrhagic fevers for 18 years. I worked on HIV, I worked on TB, I worked on plenty sick them. Well, in America, I've been getting a budget of $2 billion where they manage for 88 countries. So the president, in all the countries where they go, Tanzania, Zambia, they help them for building a health system. So the president said, hey, boy, you did go help other people there. Why you don't come home and come for help your people there? So we dropped all the team. I left my wife and we became there. I said, they come home for come make a difference. So I can also Kalo business, that commitment, I really, really believe in this country. I believe that we can change this country, we can be able to make this country not to be defined by the circumstances we're facing. Not so for do something where you're able to succeed today, or you succeed tomorrow, or you win the next election. The president envisioned for build this nation we could make sure we all be proud of her. Not only today, not only we begin and we say, this now is salon. Now salon is one. And we say the health sector now a very, very important platform for that transformation and development. And we approach not to small, catcher. You can do that very easily. You can look for the next shiny object. You are ambulance and two ambulance and hospital and something and away, all man will fall out. Yeah. But what you want to do now, fundamental shift in the healthcare delivery in this country. You don't need to do that overnight. It's a light switch where you turn on and off. So for the past 3.5 years, now major transformation on this thing, and this country. I don't feel like it. I don't feel like this. First step, healthcare delivery in this country. Now disease, now sick and defend. You get malaria program, you get TB program, you get nutrition program, you get immunization. All manner of different programs they work on a specific program. Well, all that program don't mean nothing if you're not relevant to the one person. Because the one person I need the vaccine, and the one person I need the malaria treatment, and the one person I need the nutritional support, and the one person I need the stunting, all of them need around the person. Because you can get the best malaria program in this country. The best program. Then somebody die of typhoid. Somebody die of upper respiratory disease. Somebody die of heart attack. If that didn't happen, then you find malaria program, it don't mean nothing. So what you don't do now? We don't change the complete outlook of healthcare. For say, for let me able to do healthcare in this country, we therefore embrace what they call universal health coverage. We will say everybody, all 8 million of we matter. And the healthcare system will able to see everybody. The healthcare system needs to recognize everybody and provide services for everybody at the individual level. And every one of you for able to see themselves in the healthcare system. Now that transformation, for letting you able to see everybody, we don't say everybody they go through life change stages. Start from the Beloma. The Beloma need to be healthy and strong for your own health and for the health of the living kids. So when we commit say we now yeah, every Beloma we did, now we Beloma Maria said. Now we get our belly. We get to do everything we can for all 300,000 of them Beloma every year for make sure that they remain healthy and then deliver safely. When the baby born, we get responsibility to say that baby, the first we don't fetch for in life, say we didn't have my mind, womb, say it don't come, it don't arrive. We make sure say it arrives safely. Now we get a responsibility for do all we can in the health sector for make sure say this baby it not only survive, but the baby thrive. Say this baby go kindergarten, where he ready for go school. We want to make sure say this baby are in health. It is in good places, this baby are ready for go kindergarten. When they come up kindergarten now, it goes school. We get what they call school health. We get for make sure say the healthcare system, it recognizes the school kid, it do everything for this kid health. For ensure say it healthy, so we will focus on learning. Till it become adolescent, till it become an adult, till it become a senior citizen, from pregnancy all the way to senior citizen. The healthcare system needs to see everyone and for provide services for them. So now we say Beloma, What's in that name? It means that better money, we get for make sure you get the best malaria program, you get the best TB program, you get the best nutrition program, you get the best vaccination program all around. We call it patient or client-centered care. We make sure that if they do it, don't go on, you get all in vaccinated, so you get, they die of any preventable, vaccine preventable illness. We make sure that all that they are available to them. We in this school, if the beginner is fine in a class, you remember say go learn. If you get malaria, if you say you go learn. If you get diarrhea, you go learn. So we make sure that the healthcare system, they focus on school age kids, for make sure that they sleep on a bed nets. They can forget all the vaccination, they do not get measles or other disease then. They make sure that the nutritional state right. See, for let them able to focus on their learning. So now you see, we don't change the whole of the healthcare system now across the board. And then easy way, all man used to say, the malaria program no matter work on, or the TB program no matter work on. So now we see the whole care system, everybody, you get forget patient-centered care, client-centered care. At the same time as how they do this now, when they do it at random, when they set targets, you see, for example, then below man, first let's alone in the set record in the world for the highest number of maternal deaths in the whole world. That's in the world, they score like 1,300, 1,100 per 100,000. The second place they're like 900. It is so far out. But what begin set targets there now? You see, don't begin reduce that. Take from 1,300 to 717. What kind of in 717? I don't go for 443. And the last level check, well, they can't announce the number, but you don't go down even further. We do the exact same thing for the beginning. Now we're going to declare an emergency for the beginning with the set up system for make sure that all the beginning, we monitor them from when they're born till they're 6 years old. So I just want to know, all the changes that already happen, yeah? It only will succeed if we, the healthcare worker that we understand, we're able for manage the program then. At the same time, I think the one we speaker they mentioned, they ever do healthcare if the public not mix. The public need for know, they need for understanding, therefore be co-creators and partners with me as they transform this healthcare system. You see that Nepal Ebola? Yeah? If you get the best vaccine, the best doctor, the best scientist, if this person sit down, I will say, me, I'm not even also too. Now which situation time? You know what happened? Yeah. We get a situation, we get a mobile bus and now we go. When they go to the mobile bus, the bus they go back. They say, man, I'm glad the way we colleagues from the women's journalists and talk. 60% of the healthcare use woman and utilizer for themselves and for the beginning. Yeah. So first we get for the woman respect and authority and leadership role for able to run the healthcare system as well. But besides that, then Boston they go with their packs on side, they man in the rush there. You don't see man in the only go hospital where they get injury, where they get trauma, where they fall on bike or something. But then they go there with the see the number of high blood pressure over the sea is unbelievable. The number of diabetes they over the sea is unbelievable. The number of chronic illness they over the sea inside the community is unbelievable. Until we change the healthcare system, because we get high blood pressure, manage them. By the time they go to hospital, not stroke, you don't get, or you don't get heart attack, or you don't get kidney failure. Whereas if we go inside the community, we mix them with the high blood pressure, we can manage the high blood pressure, we can go out with lifestyle changes, with what they eat, you reduce the maggi, small meat, you reduce the salt intake, you exercise small bit, you can change that. But if the public don't understand, we just don't know, we wait for the hospital. We didn't hospital now, catastrophic incident now we get for people. And I say all of this for all to understand say this now new changes where the minister say tectonic shifts now in the occur in the healthcare system. When we don't do this life stages business, WHO don't adopt and now all the countries in Africa and they send representatives for let them go begin adopt the system and see how